Hi, I'm Dr. Stephen Krueger. I'm a Mohs micrographic surgeon and cosmetic dermatologist, and I spend most of my day surgically removing skin cancers. So I'm here today to educate you more about skin cancer and ways to prevent it. So skin cancer is extremely common these days. Some studies show that 1 in 5 Americans will develop a skin cancer by the age of 70, and there are more skin cancers diagnosed in the US than all other cancers combined. So it's extremely common. We're seeing a ton of it, and our goal is to really educate people to prevent skin cancers and to treat them as early as possible. So patients and friends and family always ask me what they should be looking for on their skin that would raise concern enough to go visit a dermatologist. Skin cancers can present any number of different ways. Often it presents as a single spot, sometimes a pink bump, or even a skin-colored, or we sometimes say pearly bump on the skin that just doesn't seem to be acting like other spots that you've had for a long time. So certainly anything that's growing in size, anything that's symptomatic, it's becoming itchy, it's bleeding, any kind of symptom like that would warrant you visiting a dermatologist and having a spot evaluated. For moles specifically on the skin, there is a memory device that the American Academy of Dermatology has presented to the public called the ABCDEs of melanoma, and it's a way to remember different kind of red flag features in a mole that would cause you to reach out to a dermatologist to have a lesion evaluated. So the ABCDs are asymmetry, border irregularity, color variation, diameter greater than a pencil eraser, and evolution. So if a lesion is asymmetric, if the borders are irregular or jagged, if there are multiple colors within a mole, for example, black, brown, and a pink spot, if the diameter is greater than a pencil eraser, and E, evolution, if that spot is changing, I think is the most important kind of red flag sign to remember, not only for melanoma, but for any of the different skin cancers. That would be cause for calling a dermatologist and getting in as soon as possible to have a lesion evaluated. So when we think about skin cancer and how common it is, we have to be talking about prevention. And the main way to prevent skin cancer formation is to be safe with sun exposure. We know that sun and ultraviolet rays from the sun are the key driver of skin cancer. So protecting yourself from the sun is the most important part of prevention. Now, of course, we want people wearing their sunscreen, reapplying it, wearing hats and sun protective clothing, avoiding, the peak hours of sun exposure right in the middle of the day, seeking shade, especially during those hours. And then it goes without saying, really don't ever want people using indoor tanning beds. There's lots of good data showing that indoor tanning bed use significantly increases the risk of all types of skin cancer and skin aging. So indoor tanning is out, but going to the beach, going outdoors, I still tell patients all the time, I want them to go enjoy their lives, just to do it in a safe way to reduce the amount of basically DNA damage that the UV rays are causing. So, I still go to the beach, I get under the umbrella, I get the kids coated in their sunscreen and long sleeves and hats, and then you can still enjoy being outdoors. So in addition to prevention with good sun protection techniques, it's also possible to actually reverse a lot of sun damage and precancerous skin damage at the dermatologist's office. So we have a lot of tools at our disposal to wipe away the UV damage. There are different topical medications that can be used for this purpose. There are some procedural options. For example, we have a blue light treatment called photodynamic dynamic therapy that does a fantastic job of clearing up sun damage. We have lasers at our offices that are used mostly for cosmetic purposes in terms of reducing fine lines and wrinkling and skin aging. But we have found with some studies that it does actually reduce the rate of new skin cancer formation by doing one of those resurfacing lasers. So lots of different options, and I would encourage anyone to talk to their board certified dermatologist or dermatology provider about ways, again, to reduce the amount of sun damage that the face or neck or other parts of the body have seen. And again, with the goal of reducing new skin cancer formation that would require more aggressive treatments. So another question I get very commonly from my patients, both skin cancer patients and cosmetic patients, is what to look for in a sunscreen. And really, there are so many hundreds of different brands of sunscreens out there. You really just want to be using the one that feels good on your skin with a few key features. It does have to be broad spectrum. Most in the US are now broad spectrum, meaning they fight UVA and UVB rays. I do want it in SPF 30 or higher, and really ideally they make sunscreens all the way up to an SPF 50, 70, or even 100. Studies have confirmed that the higher the SPF, the better the sun protection factor. There are differences in the sunscreens. There are quote-unquote chemical sunscreens and mineral or physical sunscreens. Honestly, there are pros and cons to each of those, and it's really whatever, again, feels good on your skin, and the one that you're going to wear consistently is what I would prefer. So I'm frequently discussing home skincare regimens with my patients, and of course sunscreen is the mainstay of every skin regimen, but there are other ingredients as well that have their place in terms of their cosmetic uses and also, again, reversing sun damage. So that would definitely be something to discuss with a dermatologist at a consultation appointment. So there are three things I want everyone to take away from this session. Number one is practicing sun protective behaviors every day of the year. That means wearing your sunscreen, wearing protective clothing, seeking shade, of course, avoiding indoor tanning beds. Number two would be keeping a really close eye on your own skin for any lesion that may be new or changing or symptomatic, and calling right away to have that spot evaluated. And then finally, I would recommend seeing a dermatologist at least once a year, just in terms of your overall skin health. Dermatologists are the experts in skin and can often find concerning lesions well before anybody else can. Well, thank you so much for attending this part of the session. Please stick around for our live Q&A session where I'm around to answer any question you may have. Hi, everyone.
Thank you all so much for joining. This webinar was in honor of Melanoma Awareness Month, and we're so grateful to have such an engaged audience. I can already see the questions coming in, so keep them coming. We have Dr. Krueger here, who, if you haven't met him in person yet, he's awesome, and he's really excited to answer your burning questions, no pun intended. So I will, without further ado, hand it off to you all. I will be checking questions in our chat, so keep them coming. So the first one that we have, unless Dr. Krueger, is there anything you wanted to say before we jump into it?
No, let's jump right in, get to as
Good to
many as
go?
we can. Yeah,
Okay, perfect.
thanks.
Oh, and the last thing I'll say is we'll be contacting the winners by email for the ELTA MD packages. So keep an eye out on your email, and we'll also send a recording to the attendees. All right, so the first question is, what is your favorite cosmetic treatment to help take care of your skin?
That's a really good question. I would say the most common thing I'm talking about in a cosmetic evaluation is home skincare. So there are certainly some ingredients I would definitely recommend at home. Things like topical retinols or retinoids can kind of increase skin cell turnover, reduce fine lines and wrinkles, but also sun damage as well. Things like vitamin C serums and creams are great. And then, of course, sunscreen, which I'm sure we'll talk more about. If you're looking for just something that's a good kind of full face, rejuvenation procedure, there are lots of different options to resurface the skin. You can do it chemically with a chemical peel, a lot of you may have heard of. You can do it just mechanically with microneedling is a nice option for basically all skin types. And then there are lasers that resurface the skin with laser heat or laser energy. People might have heard of Fraxel or the Frax Pro device is kind of a non-ablative, low downtime way to do that. People often do 1 or 2 treatments a year for that. You can get more aggressive with an ablative resurfacing laser like CO2. People might have heard of that, which is a little bit more downtime, sometimes more of an effect. So those are all kind of some different options.
Awesome. So the next question, I'll sort of lump two together. How long does sunscreen last, and how often should sunscreen be reapplied?
That's a good question. As far as I know, the guideline has not changed that it's every 2 hours you want to reapply. I will say that the SPF in sunscreens is based on lab studies where an adequate amount is being applied and it's being reapplied as instructed, on the label. So if you're not doing that, you're not getting the amount of, SPF or sun protection factor that the bottle is advertising. So it's absolutely important not only to then pick the highest SPF because I don't think even the best of us are as good at reapplying as the bottle wants us to. But then also to make sure that you are reapplying it if you're out in the sun for several hours.
Awesome. Next question, is red light therapy safe?
Very good question. Very common question I've been getting in the last, I would say, 6 months. It seems like it's just blowing up on social media, which I think is great. There is some good, interesting data coming out for red and blue light therapy. These are not ultraviolet rays, ultraviolet wavelengths, of course, as I said in the video, are known to cause skin cancer and DNA mutations. Red and blue light are part of the visible light spectrum, and there's some interesting data on those wavelengths and their effect on cells and cellular functions. So I would say yes, assuming that it is absolutely red light only, visible light only. Yes, it is safe. Yes, we think it is effective for a couple different indications: skin rejuvenation, hair growth. I don't really think there's much of a downside as long as you trust the device or the product.
Awesome. So the next question is, what is the difference between melanoma and other skin cancers?
Yeah, so the basic difference is each skin cancer, each separate diagnosis basically comes from a different cell within the skin. So melanoma comes from melanocytes or pigment cells within the skin, and when that melanocyte has become cancerous and malignant, it just takes on a more aggressive, course than other cancers like basal cell or squamous cell carcinoma are two other very common skin cancers. So melanoma we typically think of as one that can spread to other parts of the body, can be more aggressive, and even has a mortality associated with it. So that's kind of the main differences is they behave differently. For example, basal cell carcinoma very commonly seen in fair skinned people with a lot of sun exposure over time. It's not very common for that type of cancer to spread to other parts of the body. It can just kind of spread locally, which is why, of course, we want to treat it right away. Squamous cell carcinoma is also one that can be very serious if it's, kind of left to its own devices. So again, early detection, prevention, and treatment are very important for squamous cell as well.
Awesome. So the next question, if someone had melanoma in their early 40s and they have young kids now, at what age do you think they should start getting full skin checks?
I think it would be totally reasonable in that scenario to at least do one baseline exam, even as a child. I don't see as many kids for skin checks anymore because I'm mostly doing Mohs surgery. But when I was in training with, very well renowned pediatric dermatologists, we would see a kid, for this exact scenario frequently where a kid would come in because their first degree family member did have a history of melanoma. I think it's totally reasonable to do a full head to toe skin check, kind of take note of their nevi, is the medical term for moles, just kind of their pattern, kind of then assess their risk. And for the most part, those kids aren't coming back every single year, but I think it's definitely reasonable to have a baseline. And then, of course, if something does come up on the skin exam, the pediatric dermatologist may want to see them a little bit more frequently.
Perfect. So the next one, can you go into some detail about the differences between chemical and mineral or physical sunscreens?
Yes, these questions are awesome. They are flying in, Colby. This is great.
Woo,
Uh,
I love it.
so, chemical sunscreens, they basically work by absorbing into the first layer of your skin. And, once they have absorbed, they exert their photoprotective benefits. So that's why it's important to kind of apply a chemical sunscreen and leave it in place for, I think, the label will say at least like 30 minutes or an hour before sun exposure to get its max benefit. Physical sunscreens, the main two ingredients are zinc oxide and titanium dioxide. They're actually like little metals, like little metal particles that just sit on the top layer of skin. They don't actually absorb into the bloodstream. Um, and those work kind of immediately. Now, I think most of the time, people applying physical sunscreens feel like they are a little chalkier or like a little more of a white sheen to them. And that's because they're basically a little thicker and they kind of just sit right on the skin, whereas the chemical sunscreens do absorb, a little bit better when you rub them in. Now, you'll hear all kinds of headlines and things. Every year, there's something kind of attacking sunscreens from one angle or another. I think the biggest concern about chemical sunscreens for people is some of these chemicals kind of absorbing into the bloodstream and having some systemic exposure to them. I personally am okay with it for myself and my kids because I feel like the amount of systemic absorption is so small that the risk absolutely does not outweigh the benefit to using sunscreens, and they're just so much easier to rub in. That being said, I think if there's any concern about the chemical sunscreen, I would steer patients towards a physical sunscreen. And again, the more recent products that have come out by the major companies, they are getting better. Even the physical sunscreens are getting better to rub in, less noticeable, more of kind of a matte finish.
Awesome. So I guess kind of jumping off of that, there are a number of questions that are very similar. So kind of lumping them together, are there particular brands that you like, and do you think spray or cream is the better way to go?
All really, really good questions. There's, first of all, there's probably like, I don't know, tens of thousands of different sunscreen products in the world and even in the US. So it's really just about making sure it's a broad spectrum sunscreen, which most in the US are. That means it covers UVA and UVB rays because they can both contribute to skin aging and skin cancer, but most are broad spectrum. And then you want to make sure the SPF is high enough. I think an SPF of 10 or 15, they still make them like that. I think that's kind of a waste at that point. I'd just much rather you have a 30 or a 50 if you're going to use that in your daily regimen. There's a lot that I have tried and that I like and that patients like and tell me about and give me feedback on. We're giving away some Elta MD products. That's kind of one of the best in class at this point is the Elta MD brand. I use one called their UV Clear product. It's just about the thinnest product I've ever tried before. It doesn't feel like there's anything on my skin, which I value a lot. Let's see, Neutrogena, Isden, all big sunscreen brands. Color Science has different shades for different skin tones, which I like because those are tinted sunscreens that are a little bit better at even visible light, absorption. Um, they make powders now, which is something I'm now using for my kids, like for their scalp, rather than rubbing greasy, cream into their scalp. I like the setting powders. Super Goop is another brand. So many brands out there, and I'm fine with really any of them, as long as they kind of meet those minimum criteria. Was there another question, Colby, in that?
Nope, I think you covered it. And actually,
Okay.
while you were talking about Elta MD, I know we're giving away some gift baskets today, but if you are not a winner and you're still interested in trying, our online store for the rest of May has a promotion going on where you buy two, get one 50% off. So, a good time to try if you want to stock up for summer, especially. Um, okay, so going back to SPF numbers, there was a question about just hearing rumors about anything over SPF 50 is kind of all the same. Is that true, or is SPF like 100 really better?
Yeah, really good question. And I was also in your camp, anonymous attendee who asked that one. Um, I was also under that impression until maybe 2 years ago. I think a study came out, kind of debunking the debunking myth. So the final conclusion from that study was yes, the higher the number, the better the sun protection. So 100 is actually better than 50. I would have to go into that study to see like what their methodology was to come to that conclusion. But if I had to guess, it would be again that people in the real world don't apply the sunscreen as well and as frequently as they do in the lab. So I believe it was a real world study showing that the SPF 100 patients did do better with less burns and less, et cetera, evidence of skin damage than the SPF 50 group. So I say the higher the number, the better. Colby,
Awesome.
another question I think from the last one you asked was sprays versus creams.
Oh,
So
you're
in
right. Yep, yep.
Yeah, in general, dermatologists like the creams and lotions better, at least for your first application of the day. Just theoretically, less skip areas when if you just and the sprays are so easy. I got to be honest with you. We all know the sprays are very easy. If you're a golfer, if you have kids, it's just so easy to spray them quickly down and they're done. But if you think, and I'm sure there's a study, I don't know of one off the top of my head, but of course, there would be a skip area or two. And I know I've even had that where, like, you skip an area with the spray. So my suggestion would be cream before you even go out, to the beach or even out golf, whatever, and then reapply with the spray, I think would be fine.
I feel like at the end of the beach day, you always see one or two people that have the zigzag on their back where, the wind caught it
Yeah.
or they didn't fully
Yeah.
get the whole
Yeah.
thing.
Exactly.
Um,
Exactly.
cool. Okay. We have a couple questions about whether or not melanoma is hereditary or any skin cancer for that matter.
Yeah, it's there is a hereditary component to all of these skin cancers. So I would say yes. It is not necessarily it's not like another condition where it's like a monogenic condition where you are going to get the disease your parents have because it's in an autosomal dominant fashion. It's not like that. There's multifaceted pathogenesis there. There's what you inherit from your parents, and most of that is just your skin type. I would say is in general fair skinned people. If you think about it, they don't have as much melanin, protecting their cell. It's like internal SPF if you think about it. So their DNA is at more of a risk. But it's not the only driver of skin cancer, even melanoma. We know that UV radiation plays such a huge role. And I think there's things that we have yet to figure out about what's driving skin cancer. For example, firefighters have an independently increased risk of skin cancer compared to the general population. And it's not because they're, going to the beach after their shift. So there is something probably about the chemicals that their skin is actually in contact with that's also a driver for them. I know there's a little bit of a tangent, but yes, there is definitely a genetic component to skin cancer. Colby may have dropped off by accident. That's okay. I'm just going to keep going then because I can see some of these. Um, I am sorry if I miss any questions, but I am totally happy to just keep going with these and even respond afterwards. But someone said, how can I incorporate tretinoin into my routine with sunscreen during the summer? Tretinoin is a year-round, nighttime cream. So you use it at bedtime. The sun inactivates it, so it's not worth putting it on in the morning. It can make you a little bit photosensitive, but I think that's overblown. I think people get really nervous to use it in the summer, but you can absolutely still use it. You just want to use a thin layer on your whole face and hold for irritation, right? Because it can be a little bit irritating. So for that person who asked, it's sunscreen in the morning, thin layer of tretinoin at night. Fine to put a moisturizer on right after the tretinoin if you need it. Can the same sunscreen be used for body and face? If not, please talk about the differences. Can the same sunscreen be used for kids and adults? Awesome questions. I'll just try to start to answer these quickly because there's a lot. Body and face, yeah, you can use the same facial sunscreen as for body. I think in general, the face sunscreens are bottles about this big and they're a little bit more pricey. So I think for the most part, people use the facial sunscreens where they care most about the feel of them and then use kind of a separate, more generic sunscreen possibly for their body. But no reason you can't use the same thing everywhere. It's just the amount that it would take. Um, can the same sunscreen be used for kids and adults? I would say for kids over, I don't know, I guess a year old, I think probably no differences. I think in general for kids, you might want a physical sunscreen. Kids have a higher, skin surface area compared to their overall body weight. So I would, probably push for a physical sunscreen that's not absorbing into the skin for kids. That being said, I think really you can use anything. It's just babies under 6 months old. You want to be a little bit careful of putting sunscreens on them because they're so small, of course. I think I've seen a couple questions about, people's own history and, someone said they have a condition called CLL, which it's a immunosuppressing condition. They get skin checks every 6 months. Can I rest assured that this is adequate to keep any lesions from spreading too dangerously? I think that's a nice question to kind of talk more broadly about, surveillance and in getting your skin checked. So for this person, I would say that's fine. Every 6 months is great. At least once a year for this person, and every 6 months is even better. So that's you can rest assured knowing that every 6 months, kind of a trained professional is looking even at the hard to reach spots, like on your lower back, for example, where you're not seeing, the skin in those areas, and in between, you're kind of keeping track of what's on your own skin. It's not like you have to look every day or every week. But maybe even every few months, you just kind of take stock of the different moles and spots that are on your skin. And of course, like I mentioned in the video, anything changing, new, bleeding, painful, itchy, that just doesn't seem like other spots on your skin is worth getting checked.
I am so sorry for the technical difficulties, but I am back.
Okay, Colby, we just kept it going. Thank God I have these all
You
these
seem like you're doing great.
yeah, I'm just
Perfect.
flying through these.
So I don't know if you answered this one already, but I see a couple coming in. It says you do Mohs surgery. Can you explain more about that?
Yes, I can. So Mohs surgery is a way to remove skin cancers, mostly basal cell and squamous cell skin cancers. We do treat melanomas all the time, but a slightly different approach to melanomas. But basically, Mohs is if it's a skin cancer, usually on the face or the ear or the neck, anywhere where you really can't take a whole big wide margin. It's a way to take a very small margin around a skin cancer. I go check it under the microscope at the same time. I look at all the outer edges and the deep surface of the skin cancer to make sure it's completely removed. If I see a little bit at one end, I come back and I take just another sliver where it's still positive. And then at that point, we know that the skin cancer is gone with an extremely high cure rate, up to 99% for Mohs surgery. And I then fix the wound with typically with stitches, a flap, a graft. There's lots of different ways to make a wound heal. That's kind of the gist of Mohs surgery. It's a way to take as little skin as possible while getting the highest cure rate possible for your skin cancer. I see another question. Someone said, with summer approaching, let's be honest, many of us still want that sun-kissed glow. You recommend using sunscreen with at least SPF 30, but is tanning safe at all? And if so, is there a way to get a tan without damaging your skin? Again, I have changed on this thought throughout my own life, because I used to, before I saw the light, so to speak, I used to think a tan was, better looking, whatever. Really, it's not just about sunburns. Yeah, of course, we want to avoid sunburns. We know basal cell carcinoma specifically is directly related to kind of the number of sunburns you get, even as a small, younger person, younger kid. But tanning kind of insinuates that you've had long-term chronic sun exposure, not only just over that summer, but then, of course, every summer after that for years and years and years. And that's typically UVA damage. UVA rays do that. And those are independent factors for squamous cell carcinoma, melanoma, and basal cell carcinoma. So in reality, there is no real healthy tan. I tell all my patients, they've heard me say pale is the new tan. Get used to it, get good with your own melanin content, be happy with it. I do see patients on the cosmetic side all the time that are really trying to look to reverse the clock. They're not happy with the brown spots and the pigment and the fine lines and wrinkles that have popped up. And a lot of that is from kind of the long-term chronic sun exposure. I don't know if any of you saw on on social media a couple of years ago, there was a viral kind of photo going around of like a 90-year-old who, for whatever reason, she either always wore sunscreen on one half of her. And I think she wore sunscreen on her face and not on her neck. And it just showed kind of the stark difference in the youthfulness of her face skin compared to her neck skin. So those are my thoughts for that question. Colby, you still there?
I am. It looks like I
Awesome.
don't have the questions that came in while I
No,
was
that's fine. I'll keep
gone,
reading.
but I do still have more. They keep coming in, so this is great. I think we have time for like one or two more. I don't know
Sure.
if you see any in particular that jump out at you. Otherwise, I have some that have come in the last few minutes.
There are so many. I want to answer all of them.
Here's
Oh my
one.
gosh.
Why not Mohs for melanoma?
That's a good question. So there are specialized techniques to still do the same idea of like the complete margin assessment for a melanoma on a sensitive area. That's called slow Mohs surgery, which I do, where I will do kind of remove the cancer, send it to the lab instead of me being the one to look at it. And that's basically it's a technical thing. It's basically my equipment versus the other lab's equipment.
Awesome.
And as soon as I get that response back saying that the cancer is clear, I will then fix the wound at that point. So we call that slow Mohs surgery. Anything else, Colby? Sunless tanners are safe.
Love
In
that.
other words,
I know there's a lot of people who like that.
Yeah, spray tan or fake tanners. That's the way to go. It's way better than blasting your DNA. What's your feeling about Botox? I love it. It's a whole other topic. So many good questions. What do you think about chemical peels? I like them as long as you're going to someone that's well trained and that you trust. I think they can kind of turn back the clock a bit. Oh, great questions, everyone. Colby, I'd love to try to answer more of these, even like typed out, or we'll have to figure out
Totally.
or do
Yeah,
another one.
so we'll send a follow-up to everyone with the link to the recording, and we can comb through some of these questions and send out some answers as well with it. And
Yeah,
of course,
happy to do
we'll
that.
be in touch with the winners. Yeah. That is awesome. Thank you all so much for being so engaged during the webinar. We loved your questions, and it opened a really awesome conversation. So, and thank you, Dr. Krueger, for spending your night here doing this for us and helping protect our patients.
Thank you, everyone. Thanks for joining. Thanks so
Awesome.
much. Thanks, Colby.
Awesome.
Good job.
Everyone have a great night. Thank you.
Bye, everyone.